All this with the US desperately struggling to contain the virus. Let's get more now from Ruben, who's editor-in-chief of the New England Journal of Medicine, also professor of immunology at the Harvard T. Chan School of Public Health. Thank you very much for giving us your time. I'm sure you're a very busy man indeed. Why is the rollout of a second vaccine so important?
Well, a lot of it, of course, is because there's such a shortage of the first vaccine. And in fact, even with a second vaccine, it'll be a long time before either of these is widely available to the public.
Is it better or is it easier to transport in some ways, easier to administer?
So it's marginally better in terms of transportation because it doesn't require the ultra-low freezers that the first vaccine that was authorized does. So a normal freezer is good enough for this vaccine. Still, it requires a freezer. It's not perfect.
94% effective, I guess, still means, what, 1 in 20 people it will not be effective for. Are there concerns, too, that pregnant women should not take this one, that people who have allergies severe enough to have an anaphylactic shock, perhaps, or have to carry an EpiPen should not take it?
I think that's true, and that's true for both vaccines, in fact. And right now, we just don't know. It's possible that both are safe for pregnant women. They just haven't been administered to many pregnant women. They might be safe in children. They just haven't been tested. And we don't know how common anaphylaxis will be. So I think it's more unknowns than absolute contraindications right now.
How many vaccines do you expect to be deployed eventually? And do you expect the virus to adapt to them?
Well, I'm hoping not. In fact, the virus has mutated very slowly during the course of the outbreak and in kind of a random way. So we haven't seen evidence that the virus has the ability to mutate fast enough and well enough to get around the vaccine. But it still remains to be determined.
It's a horrible comparison to use, I know, but the death rate from COVID in the States at the moment, as you will know far better than me, is something like a 9/11 happening every day. Why are things so bad? What are the chances, do you think, of getting out of this?
Well, in the U.S., as in several countries, I think we just haven't been able to take full advantage of the public health measures that have worked in other places, wearing masks and social distancing, testing and quarantine and isolation and things like that. Those have been very effective tools in some places. We just haven't been able to apply them consistently.
Dr. Ruben, thank you so much.
Thank you.